I've also got a stack to which I alluded of Obama media sycophants that are just scared to death. And even some audio sound bites, just really worried. In fact, I've got a series on CNN, 2 or 3 sound bites reporting all the glitches and all of this. The final sound bite is the CNN anchor saying, "What have we just become? Fox News here? Why are we ripping this?" Let's go do those first. We'll start here with number 14 through 17. This is last night on Anderson Cooper 19. He's got his correspondent there, Drew Griffin, reporting about the experiences people are having with Obamacare. And there's a woman here named Christy Metzger. She's a part-time teacher. That's the female voice that you hear.
After a week of trying, finally figured out just what kind of insurance she could get under the Affordable Care Act. And for her, it seems unaffordable.
And when I logged on, I was like, no, this is very bad. This is much higher than we were currently paying.
Their current plan costs $450 a month with a $5,000 family deductible. The bronze plan she found under healthcare.gov will cost her $650 a month with a deductible somewhere between $3,500 and $6,000. Christy says she has yet to find out if she qualifies for any subsidy.
Yeah, good luck with that. You believe those numbers? Look at those cost increases. And now there's another aspect here we haven't even gotten into. Now, you people in New York, they've got their own website. The New York's got their own exchange. They haven't signed up one person. I kid you not. No signups in New York State. And that's not glitches. That's not healthcare.gov. They have their own state-run exchange website. You can get on, you can navigate it. It's a little slow, and if you make any changes, you have to back up several steps. Now, on the New York State Exchange, there are 90 plans offered, and none of them, get this now, this goes right to what you heard this patient say here. There are 90 plans offered on the New York State Exchanges. None of those 90 plans allow payments to out-of-network doctors. Not even the most expensive platinum plans, which run over $1,300 a month for somebody 50 years old or so, features payments made to out-of-network doctors, which means doctors not participating in Medicare, Medicaid, or Obamacare. Now, if a plan, one of the 90 offered on the New York Exchange, if it won't pay for out-of-network doctors or services, you can get very screwed very quickly, and here's how. You can be in a car crash, you get treated in the ER, and let's say only one of the doctors treating you, only one is not in the insurance plan. You can end up owing hundreds of thousands of dollars in medical bills. And this is something nobody is telling anybody. And this is not a glitch. And it's going to happen all the time. It is happening more and more as more and more doctors drop insurance altogether because they can't make any money. There aren't any. The payments, the copays are not quick. They're not sufficient enough to guarantee the doctor a profit. That's why doctors are dropping out. And this is a major problem with Obamacare. It's not a glitch. This is how people are being penalized if they do anything that's called out of network. Okay, so now we've got these numbers. You just heard Christy Metzger on CNN. She logged on. She said, oh, no, this is very bad. This is much higher than we're currently paying. Their current plan, $450 a month, $5,000 family deductible. The bronze plan that she found under Obamacare will cost her $650 a month, $200 more, with a deductible between $3,500 and $6,000. And she doesn't know if she qualifies for a subsidy because she's damn well going to need one or she can't afford it. So we go to the next soundbite. This is another example of a small business owner who has insurance and expected to find something cheaper.
The results? no matter which way he goes, he will be paying much more.
What I found was that the plans made available were almost twice as expensive.
His renewal under his current plan will increase by 9.8% to a monthly cost of $540. His deductible will jump too, actually doubling from $500 to $1,000. Under the Affordable Care Act, he says, the most comparable plan for himself and his 3 children is much worse. He was quoted $838 a month with a $1,000 deductible, and that is after taxpayers kick in a $150 per month subsidy.
So let's get what's happening here. CNN has gone out and found people for whom this Obamacare mess is going to cost them much more, and they all thought it was going to be cheaper because they all believed when Obama said it was going to lower their premiums by $2,500. By the way, Obama is no longer even saying you get to keep your doctor. That's gone now. He doesn't even say that anymore. That was an original lie, but it's gone. So here are 2 examples so far on CNN. You don't think, I wonder, could they not have found one person who was going to benefit from this and made a big hullabaloo about that? You know they must have tried. So, okay, here's 2 examples. People expect it to get cheaper. It's wildly more expensive than they thought. Finally, the next example CNN offers last night, a 56-year-old who makes $24,000 a year.
She has chosen to have no health insurance. If she currently needs health care, she goes to a hospital and pays the prorated cost for uninsured patients.
You must have been somewhat excited.
Oh, my God. I was so totally excited.
When she finally got through, signed up, and found out she would not qualify for a subsidy or Medicaid, she learned her cheapest option under the Affordable Care Act is between $357 and $387 a month with a $6,000 deductible. It's just too much, she says.
I was hurt. I was truly hurt because of the fact that I was expecting better. I was really expecting better.
Poor people. I mean, I don't know, folks. This is, all these people were lied to. I don't know what in the world they're thinking when they go sign up and they find out all these numbers. I don't know. All we know is they're disappointed. All they know is that they're hurt and they're shocked. What, are they blaming the shutdown? That's what Obama says. This is all glitches because of the shutdown. What? Carney said there are winners and losers in this. And by the way, that's true. You know who the losers are for the most part millennials. The losers are healthy 26 to 40-year-olds who don't get sick, who are going to be paying most of the freight to cover the elderly and people like this woman, 56 years old, making $24,000, who doesn't have insurance. Fine, I'll just keep paying as I go. Found out she couldn't. She's got to pay at least $357 a month with a $6,000 deductible on $24,000 a year. She's in a state of shock. So, after those 3 reports, we now head back to Anderson Cooper, who has a guest named Cornell Belcher. He's a Democrat pollster, and Anderson Cooper wants to know what he thinks about all this. Says, this is the regime's signature piece of legislation, Cornell. They had 3 years to set it up. I know that you're obviously an Obama supporter. You worked as a pollster in the campaign. You got to admit, this is a huge misstep on their part, right?
I'm a little disturbed by that story. I mean, I think that story we just ran was a story more deserving of Fox and CNN, where you're cherry picking cases where it doesn't work. You have CNN saying, who's supposed to be sort of the, in the middle guy, saying that these are people who won't be able to afford it. We got the Republicans on the other side sort of making that case. I don't like CNN making that case making that case for the Republicans. That's my pushback.
Yeah, my pushback is, what the hell are you guys doing to us? You're CNN. You're on our side. This kind of crap ought to have been on Fox. What the hell are you doing? You're not supposed to be giving up the game like this. That's my pushback. You're making a case for the Republican plan. Who the hell are you? He doesn't once address the substance of the report other than to say, yeah, I'm a little disturbed by that story. But he's only disturbed because it ran on CNN. If it had run on Fox, they could discount it because Fox is partisan. They could discount it because Fox hates Obama. They could discount it because Fox lies and makes things up or what have you. So Mr. Cornell Belcher, what are you saying? Fox is more deserving of truth? CNN is where propaganda originates? You don't like Fox because they do the truth? These people are real people, Mr. Here are real people, supposedly, right in the demo that vote Obama. The people who think the Democrat, these are the little guys, the Democrat Party supposedly looking out for them. And they're getting savaged. They are being ripped off to shreds. And the Obamacare rep gets mad at CNN for pointing it out. This is what I mean. I'm telling you, throughout the drive-by media, they're worried about this. They're very worried. They're worried about what it all means for Obama, as they always are. They're not. It may be a stretch to say they're not concerned about these people, but I think that the conclusion here is inescapable. This is an abject disaster. It isn't a glitch. This is the way it is designed. And now people finding out for the first time, even though they've been warned, even though they were told. Got to take a break. Sit tight. We'll be back with much more after this.